It works. Absolutely works. We have such an excellent product. People get results, and it doesn't happen overnight, but the return to the classes, you know, 1 time a week, twice a week, 3 times a week, the progress is evident. They come to the Tai Chi for Arthritis class looking for better balance, teaching them how to do joint safe moves, and not just in the class, but things that they can do when they first get up in the morning, but last thing at night before going to bed.
My arthritis got so bad that it was difficult for me to work. I was too tired to exercise at the end of the day. It was too painful to exercise. And the director of the YMCA here at Kailua, Bill Stone, recommended I come join the Arthritis aquatics program. And he said, this is perfect for you. You know, you're having a hard time exercising, which I was. Come in the pool and you'll have a blast.
When I first started teaching it, because I've been practicing Tai Chi for a long time, I didn't realize that fear was a big stumbling block for most people. And the fear goes away after like 2 or 3 weeks, and it's like a light bulb goes off. It comes on, it's just like, oh yeah, I can do this.
After working out in the pool 5 days a week here in Kailua, I lost 45 pounds. But more than that, here at this pool with this class, I've met a tremendous amount of wonderful people. I actually got certified to be an instructor for this class. It's great to be able to give back to the Arthritis Foundation because they've done so much for me.
I think research in rheumatology has really grown tremendously in the last decade or so. One of the reasons that myself and many of our colleagues decided to go into rheumatology was because of really the explosion in scientific technique and new medications and new ways to study diseases that really weren't available, in all these decades before.
Professionally, being associated with the Arthritis Foundation has been awesome, and it dramatically changed my viewpoint last year when Dr. Arakawa was the honoree for the Arthritis Foundation. And we got involved with raising funds for cure. We see a lot of patients that are struggling just to sit down or get up from sitting position. It's encouraging to know that Arthritis Foundation gives out all this materials that our patients take with them, or even if it's not a patient with arthritis, they take that information and take it to someone they know that has arthritis.
I think one of the most important things that the Arthritis Foundation offers our patients are their educational materials. Sometimes we're limited in the office, with 15-minute appointments, but often we're able to kind of touch on multiple different points of a disease or different parts of the treatment. And the educational brochures, I think, are kind of the take-home messages for patients. They're able to use that as a springboard into things that they can study further.
That's part of our commitment to the cure, is for us to let them know Arthritis Foundation is there to support, to provide information.
Awareness for these types of illnesses will eventually lead to increased research opportunities, and the research will ultimately lead to better understandings of disease processes and better understanding of treatments that can help patients.
Keep teaching the classes and teaching joint safety, telling them that it works, and talking story to them about others that have had the results.
I've suffered from arthritis for years and years and sort of just dealt with it, but the fact that there could be a cure, I think would be just so great for so many people, including myself.